sun is going down sooner and the temperatures are colder. All these changes can impact your mental health. Beth Walser with Volunteer Behavioral Healthcare System joining us now live on the phone to talk more about this. Beth, good morning, and thank you so much for taking the time to talk with us and share your insight. Tell us a little bit more about what seasonal affective disorder is, because we can feel these things, but it can be a legitimate concern, right?
Yes, thank you so much, Nicole. Seasonal affective disorder is a type of depression that's impacted by the changes of seasons. So for most, it typically starts in the fall, winter months. Like you said, the sun is going down earlier, it's darker longer. In the past, people called it like the winter blues.
And so what are some of the symptoms that people can look for to see whether or not they're being impacted by this?
Yeah, so if you are noticing that you're oversleeping, you don't want to get out of bed, you're noticing appetite changes, you're eating more than normal, low energy, and even isolation, like, oh, I don't want to go out because it's dark and it's only 6 o'clock in the evening, but still, you're like, oh, I just want to stay home the rest of the afternoon, that type of thing.
Wow. What point do you think people can know, that they need to seek some kind of, seek some help or anything like that when it comes to having these symptoms? At what point can you say, okay, this is getting too serious?
Yeah, when they're starting to notice, but even their friends start to notice, they were like, wow, you haven't hung out with us in 2 weeks. Are you okay? Or, they're running late to work frequently, so if they're starting to notice these things in themselves, or even the people that they live with, like, hey, is something going on? I've noticed that you're more tired lately. You're not really responding to text messages, phone calls. Is everything okay with you? So checking in on yourself and also checking in with those that you care about as well.
Wow, I'm so glad you brought up that point about not just looking for these symptoms in yourself, but for other people in your surroundings as well. So what can people do, Beth, if they notice these symptoms? Well, how can they address it?
Yeah, so one thing that is amazing, it's called light therapy, and you can buy it on Amazon, and it just has this thing that you plug in, and you just sit in front of this light for about 30 minutes every day, and it mimics UV light from the sun. So even though it might be dark outside, doing that in the morning might be helpful as you're getting ready for work. And so doing light therapy, and then also, psychotherapy, to come in to talk to someone, because seasonal affective disorder depression can lead to deeper depression, major depression, if you just don't talk about it. And then always there's medications, and, get some vitamins in as well.
Okay. What about your interactions with loved ones? How can that help to address some of these symptoms as well?
Yeah, I think, making yourself go out and be with your friends and family, even when you don't necessarily feel like it, because once you're there, you're like, oh, I'm really enjoying this. And if you notice that one of your friends is not engaging, maybe reach out to them more, be like, hey, I'm concerned. And so being able to be with your friends and your family, especially around the holiday season, that can bring up, some thoughts of depression already, but, being with those that you care about and that, care about you, that is definitely important.
All right, some great advice and insight there, Beth. A pleasure as always. Thank you so much. And folks, if you're interested in getting some assistance from the Volunteer Behavioral Healthcare System, you can see the segment again on our website. Just go to WKRN.com and look for the Newsmaker tab.